Welcome to the Pregnancy Help Podcast. I'm Christine Grimmett, and I'm joined by our Director of Option Line, Nafisa Kennedy. And in this episode, we'll be diving into the important topic of prenatal diagnosis and trauma-informed care. Heartbeat has an initiative that was launched a few years ago to support parents who receive a difficult diagnosis during pregnancy. So we'll also mention some of those resources throughout this episode, and we'll have some information in the show notes as well. Before we get started, I want to remind our listeners that Option Line is available 24/7 to answer those who are facing an unplanned pregnancy and are seeking help. To find out how Option Line can answer your organization's after-hours calls, contact info@optionline.org. Nafisa, we have a couple of guests on with us today who are experts at walking with those who have a child that has received a prenatal diagnosis. So before we bring them into the conversation and introduce them, let's start with you. And can you tell us more about Heartbeat's prenatal diagnosis initiative?
Yeah, absolutely. Thanks, Christine. A few years ago, Heartbeat International joined a collaborative working group with Be Not Afraid, Charlotte Lozier Institute, and Her Plan. And our four organizations have been working together to launch a website, which is prenataldiagnosis.org, which is essentially a landing spot for families who are facing a diagnosis. From there, we're trying to equip them with a comprehensive network of support, starting with a hotline experience. So they can reach out to the hotline number on prenataldiagnosis.org. They can chat, or they can reach out via form if they feel more comfortable doing that. And then Option Line actually handles those interactions, and we're able to help get those clients routed to a Be Not Afraid trained parent care coordinator that serves their community. And parent care coordinators, as our listeners will hear later in this podcast, are really amazing at providing support throughout the pregnancy and beyond. I'll let our resident expert here share more about that later on. But Heartbeat has been so blessed and honored to participate in the collaborative working group, and we just look forward to continuing to advocate for families facing a diagnosis. And today we're actually really honored to have some experts among us. And first up, we have a medical perspective offered by Dr. Robin Pierucci. Dr. Pierucci, would you please share a little bit about your background, your work as a neonatologist, serving families facing a prenatal diagnosis?
Well, thank you for having me here. It really is a privilege. After 25 years of being a clinical neonatologist and on call on the unit, I also have had the opportunity to work with Be Not Afraid and become a parent care coordinator. And I thought I was going to attempt to retire after 25 years of being on call. And that lasted 4 minutes before founding Navigating Fetal Concerns, and really as a way to expand the wonderful work that began with Be Not Afraid, where I've been a medical consultant for a bit. But, it's funny. It really, this whole thing started many, many years ago when during a perinatal consult. So as a neonatologist, I get to talk with moms before the baby's born, and I was called in to talk with a mom who we knew the baby had a diagnosis of Down syndrome. And I opened the door to introduce myself. And before I could say anything else, the mom burst into tears and said, "Why do all the doctors want to kill my baby?" And I was shocked. And it really was the first time it became so crystal clear to me that a prenatal diagnosis can be used as a barrier to postnatal life, and just the level of inappropriate that is. When doctors can pretend that we have this crystal ball and 100% know what's going to happen. It's a kind of a lack of humility in front of how much we don't know. Yes, medicine has come a long, long way. However, there's a whole lot we don't know. And it's actually part of what's fascinating and wonderful about getting to do this. and walk with people to let the baby tell us what they need and what they don't need, and give them a chance to be stabilized and evaluated, just like we would for any other human being. They all deserve that.
Absolutely. Now, some of our listeners might not be as immersed in this world of prenatal diagnosis. So would you mind sharing a little bit, maybe kind of on the definition side, what is a prenatal diagnosis and what are some common misconceptions about test results?
Sure. So a prenatal diagnosis is just really any diagnosis that you get prior to the birth of your baby. I'd love to remind people that the first diagnosis is, it's a baby. Yay, it's a boy, it's a girl. And I love getting to ask people what the name of the baby is. But no other diagnosis ever negates diagnosis number one. That this is an intrinsically valuable human being is the most important thing ever. And the other stuff, okay, we'll see how much or how little that impacts everything else, but it certainly never negates it. What's complicating our world today is that we've had an explosion of prenatal testing that has gone earlier and earlier. And there's a difference between diagnostic tests, which have a higher likelihood of being true, and screening tests. A screening test is kind of supposed to be a catch-all of sending up a warning sign something could be wrong, but it's not. It doesn't tell you for sure with 100% accuracy ever that the baby has or does not have something. You can get a predictive value, but those can be pretty misleading. And unfortunately, what happens today is many women go in to get prenatal testing and it's really routine. So sometimes there's just not even informed consent. It's just, I'm getting my prenatal test. Some obstetricians do, a much better job with telling people about, what it is. But sometimes I often hear women tell me, I just thought I was getting a gender reveal. They didn't know that all this other stuff was going to come with it. And what often happens, as soon as there's even a suspicion that there's something wrong with the baby, it's hard to hear anything else. It's part of the trauma of what happens when out of nowhere you get this diagnosis that something could be wrong. And it's hard to even sort out that it's not 100%. In fact, sometimes it's like 20% correct. But it's hard to hear that. And insult to injury, we have a world where if the baby's not perfect, many of the obstetricians feel it is their duty to then offer a termination. And it's at a moment of crisis when people are so vulnerable and just don't even know what to think. And then to get offered that, it's really brutal. And it's hard to be able to say, wait, stop. I need to slow down. I need to understand what's going on. And that's, like I say, all part and parcel of the traumatic injury that happens around prenatal diagnosis and all the explosion of testing that can happen very, very early in a pregnancy before a mom has really even had a chance to fall in love with her child. That's hard to see.
It sounds like almost instantly with these screening tests, the parent is faced with several challenges. What are some of the other challenges that parents may face in the medical system while navigating care for their baby?
It's a really important question because as they move forward, they're depending on what has been discovered. And we're talking, when I say discovered, once again, we're talking about through either a blood test from mom with some of the screening tests, or various ultrasounds, or even more specific, an echocardiogram if there's suspected heart issues. But still, it's not like examining the baby. It's not equivalent. And what can happen, especially if there's a genetic diagnosis, is people will say, well, if you have a certain arrangement of your chromosomes, then we don't offer you certain services. We don't offer certain interventions. And that's heartbreaking to have that removed before you've even met your child. Talk about crushing hope. That is really problematic. The good news is that just in July, the AAP, the American Academy of Pediatrics, released an article that said, specifically with regards to trisomy 13 and 18, but I would challenge for all genetic diagnoses, it is completely unethical to not offer services based on those genetic diagnoses, which is so important. We don't know how a baby is going to react to care, to evaluation, stabilization until we meet them. Think about it this way. If you get a diagnosis of cancer, I've known people who've lived 3 days. I've known people who've lived 30 years. We don't know so much until we actually meet the unique individual. Now, I'm not saying every single test and every single intervention is appropriate all the time. We need to be prudent and wise, but we need to use it with medical excellence and compassion. Look at the individual in front of us and see what is appropriate to do and what is not. Nobody wants to prolong inappropriate suffering, but I also don't want to remove hope or the chance of success before we actually know what's going to happen. That's being a self-fulfilling prophecy. For example, at the edge of viability at 22 weeks, and now we have increasing cases of 21. If you never attempt to resuscitate those babies, none of them survive. The same kind of thing with many of these prenatal diagnoses. If we never attempt to intervene, then we can determine what's going to happen next. But we can also give these little ones a chance. And gosh, once again, looking at them through their parents' eyes, this is someone's son or daughter. They are treasured and they are valuable. There is to predetermine that this is a life not worth living is just inappropriate. And we need to be really very careful about that. This is our privilege to get to care for these little ones.
It sounds like that article provides some promising recommendations, both for the medical community and for maybe support outside of a physician. And I wonder if Heidi Martin, who is our next guest on the podcast today, she is a parent care coordinator with Journey of a Lifetime and has been on the Pregnancy Help podcast before. We will have a link to those podcasts for you to check out more about her background. But Heidi, would you care to share more about the implications for services such as parent care coordination?
Yeah, so thank you again for having me on this podcast. It's truly a pleasure, and I appreciate y'all's support of Journey of a Lifetime, PCCs, doctors like Dr. Pierucci for serving families during these crises moments. But in referencing the AAP article and your question about how Journey of a Lifetime and PCCs can be providing a support and a solution to prenatal diagnosis, they actually state in a section called Considerations for Perinatal Care Coordination, which right even there, I was caught when I read that because my title within my organization is Manager of Palliative Care Coordination. So that's exactly what we're doing. We're doing care coordination and integrating families with a prenatal diagnosis into the medical community and helping to align services for them and their child. And they say, consider identifying a designated longitudinal health professional. So that could be a social worker, a nurse like myself, case manager, etc., to provide support and care coordination. So they really speak right into everything that we are already doing. So it's awesome because the services are out there. We're out there. And now we have the medical community kind of backing us and saying, yeah, this is actually what these families need. And so it just strengthens our role and the services that we're providing to families going through this.
That is an incredible affirmation of what you are doing and what we're trying to do collaboratively to provide access to support for these families. Maybe you could help our listeners understand a little bit better when a parent receives a prenatal diagnosis and you come alongside them as a parent care coordinator. What is your role? What does that look like?
Yeah. So again, I speak in depth to this in the previous podcast, but I will try to summarize it concisely. It's essentially we describe the service that we're providing to these families as palliative care case management coordination. So that palliative aspect means we recognize that there's a complex diagnosis, and so therefore the parent and the infant will require multiple disciplines to support them in a way that acknowledges and maintains quality of life. So they're still obtaining medical care and treatment, but we are respecting quality of life and recognizing that we don't necessarily know the length of days. By no means is it hospice or comfort care. They're getting treated, they're getting surgeries. We're not providing that, but we're supporting that approach to care for their child in the medical community. So once I receive a referral for a family who's needing support, I will reach out to them and we'll have a lengthy discussion so that I can determine the greatest needs for them moving forward in their pregnancy as they carry their baby to life. And oftentimes, the greatest needs identified are really in the area of medical education. So, as a PCC, utilizing my nursing background and my knowledge, I am looking to provide them with diagnosis education. So, as Dr. Pierucci was just discussing that prenatal diagnosis that their infant has been given, educating them on what that looks like after birth, the physiology behind everything, explaining the medical terminology. If there's a heart defect, educating them on how the heart works normally, and then beginning to break down the understanding of the heart defect in lieu of all of that. And then we'll even touch on like NICU education. So, if there's an anomaly, like a heart defect that we're dealing with, the child is probably going to go to the NICU or a cardiac ICU. So educating about what is the NICU and what goes on there. And then also birth plan education. And through this educating, we're providing them with informed consent, which essentially means that we are using science-based research. We're collaborating with medical professionals in the field like Dr. Pierucci, and then education is being provided to them that is grounded in evidence-based practice. So we're not giving opinions here, but everything is very grounded in research and medical statistics and so on and so forth. And then from that fundamental place of knowledge and information, the parents are then informed and therefore empowered to begin creating their birth plan and support them in that process as well. And ideally, this birth plan is something that's going to be disseminated to the medical care team that they're working with. So their OB, the maternal fetal medicine doctors, the neonatologist, which is like Dr. Pucci, who are working with the babies in the NICU, and anyone else that might be integrating into the care of this baby moving forward. If they haven't been connected to referral services like neonatology or cardiology, then JOL is going to help connect them with those services as well. I always encourage my parents as they're approaching that delivery date to have an established connection with the neonatologist at the hospital that they're delivering at and to get a NICU tour. Because as we approach everything from a trauma-informed lens, I want to lessen and decrease any future trauma. So getting simply a NICU tour and seeing that space before they're in there can really lessen any trauma that might happen after birth when they enter into that NICU, as well as participating in the interdisciplinary meetings with the family. All of these things are PCC roles that I take on when I initially see a client.
Thanks for explaining that, Heidi. You mentioned trauma, and one of the things that I'm curious about, because when someone is experiencing a trauma, often they have impaired executive functioning. So I imagine the education that you provide has to really be tailored to that trauma-informed approach. So how do you apply trauma-informed principles when you're supporting families?
A very good question, a very important one. In order to provide that, it's essential that I build trust with my families that I work with. And so much of that trust is built through active listening that occurs over multiple communications with them. So as I listen for their needs that they convey, and I listen through the words and assess what they're saying, I can work with them to establish a plan moving forward, and combined with a lot of compassion. So compassion, timely, accurate information and communication. This then leads to the development of safety within the clients, which is a key component of that trauma-informed care. Once they trust you, then they can feel safe, and then they really begin to exit out of that trauma state, that fight or flight state. And then this just kind of paves the pathway for the rest of the trauma-informed principles that to really play out. Things like collaboration, empowerment, respect, and peer support. So I really try to work from this place of trust and safety. And so as the parents become educated and empowered, they can build that strong birth plan. But it's not just the birth plan that I'm really working on. I'm working on them building strong parental voices for their baby. So where they felt defeated, disrespected, even devalued at the time of receiving that prenatal diagnosis, again, from that place of trauma-informed care where we've established safety and trust, they now feel empowered, their voice is back, and they have the information, the education that builds up confidence in them, and they can go forward and express their desires and wishes to the medical community in a way that is clear and concise and medically grounded, because that's what the medical community really appreciates as well. And I like to really adapt this model to each family as I assess their needs and learn their story, because some families are coming to me really traumatized. And so I can't necessarily come to them with a questionnaire. Sometimes when we first meet, they literally just need to vent or emotionally vomit, if you will, all that has happened to them. And again, I'm just that listening ear, and they need someone that hears them, that says that what they feel is real and maybe even warranted and justified. And allowing them to do this actually does give me all the information that I need. And I think it's really important to emphasize that with each family that I support, being mindful of that trauma-informed approach, that this cannot be a cookie cutter process. The story that each family brings to this moment in time is truly unique. Their baby is unique and distinctive as a human being. And so it is critical that I acknowledge their story and tailor my support to it.
I love that. And it's so different from what they would have received up to that point. I just love the personalized approach. And speaking of that more personal side of things, we are so honored to have a parent who has been through this journey with the parent care coordinator. And Maureen O'Connor is here with us today. And we're so grateful, Maureen, that you're here to share your story. Would you like to just kind of give us an overview of your child's diagnosis?
Sure. Yeah, it's my honor and privilege to be able to talk about my son Luke, and our experience with his prenatal diagnosis. And I just have to put a plug in for these two heroes that we're talking to right now, Heidi and Dr. Pierucci, because if it weren't for physicians and parent care coordinators like them, the experience my family has had would have looked vastly different without their, loving, caring approach to families like mine. So many thanks to them both. But yeah, my little son Luke, he let's see where to begin. He was a very complex baby we had actually declined prenatal testing up to that 20-week mark. And so we kind of walked into, that big scan, the anatomy scan at around 19 weeks, kind of cold. We hadn't sought out any information prior to that because we knew it wouldn't change anything for us. And it was evident right away that there was something wrong. My husband is a radiologist, so he knew right away, like when we started the scan, we were dealing with like a very complicated little guy. So he had a congenital heart defect. He was measuring very small. There were, just kind of a constellation of findings. And, right off the bat, the provider who we saw after the scan was like, oh, it's probably Down syndrome. Like, how would she know that? And then, she just kind of washed her hands of us and said, oh, you're going to have to be seen by maternal fetal medicine. And we sent your information to them and they'll be in touch. And they just kind of pushed us out of the office and that was it. So, the trauma started there because up to that point, the pregnancy had been textbook and this little guy was just longed for and prayed for, and we were thrilled about him. And then, on the flip side too, for my husband, he started having to kind of be a consulting member of our son's care team. So he, was really on the patient side, but we learned very quickly that it's hard to be a physician for your own child. So there was a lot of trauma there to unpack for him. And the whole experience, from that kind of like diagnosis day was very ostracizing. We had never known anyone who had gone through something like this before. So we found ourselves having to kind of like explain to our friends and family things that we didn't even really understand ourselves or were still trying to unpack. And then eventually we did get in with MFM and, they were pushing lots of testing. We did end up doing non-invasive prenatal testing, which kind of came back inconclusive. There was nothing that like popped on that test, so to speak. And then there was a genetic counselor involved on their team who was kind of pushing us to do amniocentesis and CVS and various other kind of more diagnostic tests so we could really know, what was going on and what was wrong. And at that point, we kind of decided, what, he's being monitored. We know what specialists we need to get in touch with and who we need to kind of set up care with for after he's born. So we decided, at that point, knowledge isn't always power. And so we elected not to do any further testing. As it turns out, Luke had, and we found this out after we did a karyotype after he was actually born, he had something called an unbalanced translocation. So he was missing, he had a little too much of some genetic material and and not quite enough of it. He had a deletion on another chromosome. So, but at that point, we could kind of see who he was. He was there in the NICU with us. And it was a lot easier to kind of like process that information when he was right there in the room with us and everyone who was talking about him. So it certainly made it easier to kind of process who he was and what that all meant when he had a seat at the table, so to speak. And throughout this whole process, we connected with Be Not Afraid, and they were, our lifeline for everything. They helped us deal with the medical side of things, the emotional side, the spiritual side, the familial side, and they really helped prepare us, despite us having kind of like probably more medical knowledge than the average parents going through this. My husband would certainly agree, like we just felt so ill-equipped, and they just held our hand through everything. They helped us prepare for our son. They helped us welcome our son and into the world. And when he did end up passing away at a month old, and they held our hands through his death and his funeral and his burial, and, right up to this day, which is, 6 years later. Their involvement and their unique model of care, it was life-saving and life-giving to us.
Thank you so much for sharing your story and sharing about your precious Luke. Looking back at your story, what forms of care or communication made the biggest difference for you?
Well, Heidi certainly addressed this probably more thoroughly than I ever could, because I was on the receiving end of things. But, it was a difficult exercise, but probably the most important thing we did was we made a birth plan, but we also made a death plan. And I still remember the night we sat down to actually do it or start it. I was like, I don't want to be doing this. Like, this is not what I want to be planning for, either piece, but those two things were like so singular in our ability to cope once Luke was born and when we were managing things while he was with us. And then I think most people would agree that the death of a child is, every parent's worst nightmare. You wouldn't wish it on your worst enemy. It's the most difficult thing I've ever gone through. And we had made a lot of decisions prior to him passing away. So we literally had a reference point. I mean, we were talking about impaired executive function. I was postpartum and, my baby had just died. I wasn't exactly in a position to, say, oh, where do we want to bury him? And who, what kind of time do we want with him? And what does that all look like? We had a plan in place. So thankfully, my mom and dad were with us when Luke passed away. My husband, his first phone call was to his parents, and his second phone call was to Tracy Windsor with Be Not Afraid. They were with us every step of the way, and we didn't even have to communicate anything to them because they knew what to do. So they immediately, called the funeral home that we were going to use and got in touch with all four of our parents, and they just kind of handled everything for us. So those two things were absolutely critical. And then I will say too, just the exercise of putting pen to paper was very kind of cathartic and therapeutic. You're kind of in a slow motion car crash when you're dealing with prenatal diagnosis. Everything feels totally out of your hands and out of control. And being able to prepare for your child in a concrete way was just, very, very therapeutic, and helped us feel more like, just a regular mom and dad, because we were just preparing for our son. Didn't really look like, the usual preparations, but I felt like I could be a mother to my son that way, getting ready for his arrival.
Yeah, I love that. And I love that Be Not Afraid gave you that gift. And it's our hope that we can extend that to as many families as possible. I'd love to move us into an open discussion. So all three of you are welcome to chime in on any of these questions we have coming up. The first one I think is really important because even if we don't personally face a prenatal diagnosis, or even if we're not personally involved in the care of someone facing a prenatal diagnosis, we are probably going to encounter a family at some point that's either grieving due to a prenatal diagnosis, or, maybe they've received screening test results that feel really devastating to them. So what can we do to avoid unintentionally re-traumatizing parents through our words or actions?
I'll chime in first. As one of those parents myself, I think, back to this notion of knowledge isn't always necessarily power, or, as Dr. Pierucci put it, like a crystal ball. Like, let's not prognosticate, let's not say, oh, your child is probably going to die, or your child, if they make it past this point, they're going to have, they're going to suffer immensely, or, whatever it may be, X, Y, and Z. I think that's a big piece on the family side of things. And really, I think we could have been spared a lot of trauma and suffering ourselves as parents if people had just taken the let's just see what he looks like when he gets here. Let's just evaluate him and see what his needs are when he's here. And rather than putting us in touch with the specialist who would be rounding on him after he was born, we were immediately, of course, put in touch with pediatric hospice, things like that. Like, let's just frame it from a place of hope as opposed to, oh, your kid is definitely going to die. And if they don't, it's going to be rough, because we don't know.
I think that's so important, I don't know. So permitting people to fall in love with their child as they are, whether or not there's something, quote, perfect or not perfect. I mean, raise your hand if you're one of the perfect ones. So coming alongside someone with, I love that phrase, sacrificial listening. How do I get to just open my heart to where you are right now? And the baby is valuable exactly as they're made. We're not in charge of the bigger script, but how do we make the most of this moment? And I love encouraging parents to say, go with, your pregnant tummy. Where is your favorite place? And have a picture of all three of you, or take the other kids, and making a treasure of memories that are valuable now. I have found to be just a gift to be able to do. And for the friends in the family, showing up with what I call, the Eeyore face, I'm just like, okay, would you please go giggle? Permission to laugh and smile through the tears and hold hands. And what do you need to do? Really specific things like, how about bring dinner? And because when you're running back and forth to different doctor appointments, and if you're juggling other kids, I mean, just the complexities of all of that. What else needs to be done? And like I say, showing up as a friend in both the reality of, here's what we know, here's what we don't know. It's really hard to live in the area of, I don't know. We all, keep our calendars and various, books, and we're not in charge. That's hard. So acknowledging that and deciding how to live in this moment with this child and go, okay, how do I love you now? And is both there's something very freeing about that, as I give parents permission to tell other friends and family, yes, go ahead and name your little one. Tell other ones so that you break that isolation. That's really, really important in this whole process of this thing that we're not in charge of.
And I'll add very simply, and I kind of alluded to it already, that it's really hard for compassion and trauma to coincide. So if we're operating from this place of compassion with whoever we're journeying with, your actions, your words, if they come from a place of compassion, I think most people can then sense your sincerity, and that you're not going to cause further trauma. And also stopping before you speak and thinking about what you're about to say, recognizing, maybe their actions and the words that they're saying that might be alluding to you that they're in that place of anxiety and stress and grief, and choosing your words wisely. Doesn't take but a few moments for us to do that, but remembering this isn't about us, but it's about the person who's going through this and how we can support them.
Absolutely. Helpful information here that you're sharing with our listeners. I so appreciate all of this wisdom that you guys are providing. Looking at the medical professional kind of provider perspective, what is one thing you wish every provider understood about trauma-informed care?
I wish that every medical professional, everywhere along the way, was able to see the baby, see the patient, and not just the diagnosis. Because then we remember that we're caring about a human being that has intrinsic value, so that perhaps we don't have to traumatize the parents. It's still going to be sad when you have to break bad news. That happens in medicine. It happens in critical care. That's part of what goes on. But you can do this with a compassionate voice that is very different than, oh, here's what we found today. Bye. And abandoning someone to the next appointment. Very different to show up next to someone, recognizing this is their loved one, than just another diagnosis to get through.
I will add also from the nursing perspective, this is something that I really experienced in the NICU, both as a nurse and then as a mother of a baby in the NICU, is that this is this family's story, not the medical professional's story. And they have been living a life and a journey all the way up until this point in time. It didn't just start, their life didn't just start, and their journey didn't just start once they came into this moment of a prenatal diagnosis. And I think the medical community really misses that a lot. And it almost becomes like this is the medical community leading it, and not that this is a moment in time along an entire lifespan of this family. And so it's so important that the medical community step into the family's journey and not the other way around. And when the family senses this and sees that effort is being applied, I think it makes a huge difference. So my encouragement to medical providers would be to resist the urge to guide them down your path, but seek to rather provide a healing environment and step into their journey.
I couldn't agree with you more, Heidi. I will say, like, anecdotally, through our experience with Luke, and as I mentioned, he is very complicated. We had neurosurgery and neurology and cardiology and neonatology and, pediatric intensive. I mean, we had, I can't even tell you how many people were involved in his care. And only one provider out of all of the people who were rounding on him daily, only one provider, our geneticist, she's the only person who ever congratulated us on our son. I found her at his bedside for the first time. I had stepped away in the NICU, and I came back in, and she was standing at his bedside, and I remember just like, my back was like up, my mama bear instincts were kind of coming out, and I was like, who's looking at my baby, and what is this lady going to say? And she was just like, he's beautiful, congratulations, we're so happy he's here, and we can't wait to follow him in clinic. And she gave me so much hope just in that like 2-minute interaction. So I think it's also really important for providers and practitioners to remember, like, this is someone's whole world who you get to treat. And Luke certainly was ours, and we're still very close with that doctor. She's wonderful, and it made all the difference. It really made all the difference for us.
I love that. Every baby is a reason to celebrate. Definitely a message that all of us should be carrying around with us. My last question for you all is, what are some practical ways that churches, ministries, or pregnancy help organizations can better support these families by providing trauma-informed care?
I think, first of all, the recognition that there's a traumatized person is like key to, then you can, the ripple effect of all the other steps, it kind of falls into place. Recognizing that trauma takes your brain offline, that it's not possible to function at your normal capacity. So being forgiving of that person and meeting them where they're at. And then, gosh, I just cannot echo enough what Maureen said about say congratulations. This is your on your pregnancy and accompanying with them, providing them a safe space, whether it's an angry day, an upset day, I mean, whatever, that's okay. That safe space and connection so they don't have to be isolated and sobbing. That's huge. That is compassion, literally walking with someone. And it's hard because it's hard to walk into anyone else's trauma, much less our own. And yet that's what friendship is. That is, especially as a church family, we are called to do for each other. So reaching out in those places is huge. And like I say, and then because I am genetically programmed myself to feed anyone who comes to the door, what can I do for you? What food can I bring? And chocolate does heal a lot of stuff. I'm pretty convinced, in particular, the chocolate chip cookie food group. So in addition to chicken soup, but chocolate chip cookies are right up there. So once again, showing up with your heart and that understanding of the trauma of things are not okay is a physiologic and psychologic process. And it affects you. Your whole body kind of feels battered. And gosh, how do you pick your head up and move forward this day? And sometimes just knowing there's a friend who's arriving with your very favorite Starbucks goes a long way.
Dr. Pierucci, I'm imagining a lot of chocolate chip cookies in your NICU. I'm sure it was fun working with you. But I'm going to jump on board with that. But fast forward a little bit after birth, our goal is to carry these families and these babies to life. And many of these babies do go on to live many, many years, lots of life. And me speaking as a mother to a medically fragile child who has journeyed, my eyes have been open to a lot of things. And so that's kind of the perspective I take when I think about this question of how the church can engage some practical ways for churches, ministries. Where I see a need within the church is specifically like in the walls of the church for there to be support groups and support services set up for families who are either walking through that complex pregnancy or already have the medically fragile child, because it's a very isolating journey. Typically within the walls of a church, there aren't going to be numerous numbers of families going through this. So, but if there's a support service that's already established for these families that they can plug into and connect with those other families who are walking through a similar situation, that's extremely, extremely helpful. Because again, it's hard enough to be isolated just throughout life as a natural byproduct of, you're at this doctor's appointment or you're at this therapy. And so those things just kind of pull you away from the community a little bit. But to know that you can go to your church and that community is established and they've had the forethought to establish the resources and the services specifically unique to what you're going through. If the church is going to engage in the pro-life conversation, then I think that we also have to attach an actionable response to, okay, these babies go on to live and they have support, but these families, they need the church to engage on that end of the spectrum with them too. And it may even look like, okay, well, the church doesn't know where to begin with. Well, then you bring in organizations like Journey of a Lifetime or Fetal Concerns to host a class to just generally educate those in the church to the ways in which they can support these families and help act with them and bring them into the church community and make sure that they're not isolated.
This is all incredibly important, and I'm so appreciative, Robin, Heidi, and Maureen, that you joined us today to educate our listeners. Thank you so much for being here.
Thanks, Nafisa. We have a lot of resources on this topic. Even through Heartbeat Academy, we've done workshops, webinars. We also are hoping to get future podcast episodes recorded on this topic too. So we're kind of creating this library of ongoing training so that we can help serve these families in the best way possible and help pregnancy help organizations to recognize their role in this and the opportunities that they have to serve these families. So I hope our listeners are subscribed to the podcast if you have not already, so that you get notifications for those future episodes. And thank you for listening to this episode of the Pregnancy Help Podcast.